Student is wearing appropriate PPE, including face shield, mask, gown, surgical bonnet cap, and utility gloves. Demonstrates correct preparation of ultrasonic cleaning bath, all of the units. We are going to fill with water first, and then we are going to add enzymatic solution. This particular bath is 6 gallons. We need to add 1 ounce of solution per gallon. We need 6 ounces of this enzymatic solution. You will pump into the cup 6 ounces. We are going to place the lid on top. It should give you an option for degas. We click yes, and it will run. This particular machine will not stop degassing, so you will have to manually come in after 5 to 15 minutes to degas. This tank is 5 gallons. Here we can alter the time with the up and down arrows, 5 to 15 minutes. We are going to go ahead and hit ultrasonic. Retrieves instruments from contaminated area of clinic. If instruments cannot be cleaned for an extended period of time, immerses instruments in a holding solution in a plastic transport bin labeled biohazard and places in the bottom of the sink. We are going to place the instruments spaced 1/2 inch apart in the ultrasonic cleaner. We are going to put them in without immersing the hands, and we are going to articulate the appropriate amount of time for the ultrasonic unit and activation. For loose instruments, we have 7 to 10 minutes, or for cassettes, we have 16 to 20. We can increase and decrease the time over here. She put a cassette in. We are going to hit start. After time has expired, removes instruments from the ultrasonic cleaner with utility gloves. She is going to lift up the basket to retrieve the instruments. This particular unit, you can place the basket on top of the lid, and she's going to shake off the excess over the ultrasonic, bring the cassette over to the sink, rinse the cassette, inspect the instrument for any remaining bioburden, shakes off excess water, and then we are going to put the cassette on this absorbent material, let it dry off before we bag. Instead of using the ultrasonic bath, we do have the option to use the Hydra. So the student will load the cassette in a vertical placement like this. And then on the bottom rack, same thing, vertical placement, just like that. We are going to slide the drawer back in, shut the door. You're gonna have to use a little bit of force to shut the door. Over here, we're going to press heavy duty and then press start. Places in an appropriate size autoclave bag or utilizes autoclave wrap. In this instance, we're using the autoclave bag, and we are going to label with the student identification number, which is A24. We have the date, which is 4/28/25, and then we are also going to write which sterilizer number on the plastic side of the bag. We are using permanent marker only, and we are going to peel off the tape, fold over just slightly. Make sure that bag is sealed, there's no gaps, and then we can get that ready for sterilization. We are going to verify the water level on the autoclave. As you can see right now, it is empty. There are 2 options that you can do. One is to get the hose from the sink and fill this with distilled water. You can see the water level rising. You need the water level to be within the green marker. The other option is to grab one of the gallon tanks or gallon jugs that is filled with distilled water and dump it into the port. The water level is now in the green, and we are ready to load the sterilizer. Places instrument packs / bags plastic side up in autoclave for sterilization. Rows are going to be 1/2 inch spaced apart and processed according to manufacturer's directions, including any directions on the machine. The door is going to be closed. We are going to select pouches and then start. After sterilization of instruments, we are going to remove from the autoclave with clean, bare hands. We are going to place on the appropriate cooling rack, ensure sterilization with the color change versus what is on this side, which has not changed, so this is good. We are going to place plastic side down on the rack to cool and dry before placing in student bins. We are now going to drain and rinse the ultrasonic units. In order to drain, we are going to open this lever. The water should be flowing down that tube directly into the sink. So this will take a little while to drain. Once drained, we are going to clean the inside of the unit and the inside of the lid with soap and water. We are going to rinse, dry, then we are going to disinfect with the Cavi wipes afterwards. Once the tank has been cleaned and disinfected, we are going to leave the lid partially off and partially on so it has a chance to air dry. Cleans and disinfects contaminated trays, lids, and countertops. So we are going to throw away all disposable products. Then we are going to wipe down the countertop, the lids, and the trays with the Cavi wipes. We are going to do a cleaning step and a disinfecting step. Washes utility gloves twice with soap, dries, removes from hands, and stores gloves. Then wash hands using antiseptic hand washing protocol.